Now that you or a loved one has been diagnosed with myelofibrosis, you probably have some questions. Like, what is myelofibrosis? How does it affect your life? What are the symptoms and what treatments are available? Getting a blood cancer diagnosis can be overwhelming. Through this series, we hope to help by answering some of the most common questions patients ask about myelofibrosis. Here today to offer his expertise is Dr. Aaron Gerds from the Cleveland Clinic.
Today, I'm going to try to help you understand your myelofibrosis and explain different things about the diagnosis and symptoms and mutations and pathways, all part of this disease. So myelofibrosis is a blood cancer, a type of chronic leukemia that can lead to abnormal blood counts, enlarged spleens, and significant symptom burden.
Myelofibrosis gets its start in the bone marrow, the spongy insides of our bones, where blood cells are made. Researchers are still trying to figure out what causes myelofibrosis, but what they do know is certain mutations in the genes of new blood cells plus inflammation in the bone marrow are major drivers of this disease. While many mutations and many routes of inflammation have been discovered in myelofibrosis, the three most common mutations are JAK2, CALR, and MPL, and the most common route of inflammation in myelofibrosis occurs when something called the JAK-STAT pathway is activated.
So the analogy that I often use to explain JAK-STAT activation and why it leads to abnormal blood counts and bone marrow function is using an analogy of comparing it to a furnace and a thermostat. In your home, you often have a thermostat on the wall, and that thermostat senses the heat in the house. And when the heat drops and you need more heat, the thermostat kicks on, tells the furnace to make more heat. And then once the levels come back up, the thermostat shuts off and the system works as a check and balance to kind of keep things in the middle. What happens is when, say, the JAK2 gene becomes mutated, or the calreticulin gene becomes mutated, or the MPL gene becomes mutated, that signal is on all the time. If your house is nice and hot, you're in your shorts, your t-shirt, you're kind of fanning yourself, but that furnace is still burning. And if you went down to your furnace and took off the cover, you would see all the wiring is all messed up within the furnace. It's not listening to the thermostat anymore. And that's ultimately what has happened when these JAK-STAT mutations occur. The wiring in the furnace is all messed up and the furnace is just going and it's on all the time. This JAK-STAT abnormality is what starts it all off, right? But there are so many other pathways. It's not that simple, of course. Just because the furnace is all messed up, the whole house system kind of starts crumbling. The air conditioning, the water pressure, the windows start opening and shutting, all your automated garage door starts flapping up and down. So the whole system goes haywire. And when the whole system goes haywire beyond the furnace, within the house, that's when we see a lot of the blood counts coming down, because all these other pathways are so much more critical in the production of blood cells. It's not just the furnace, it's the whole house system completely is dysfunctional. So as a newly diagnosed patient, your doctors and healthcare providers are going to be telling you all kinds of different stuff over the next several weeks to months. And there may be some terms that are thrown out there. And I think these terms are important to understand. We think about myelofibrosis in a lot of different ways. And just like patients can have lots of different symptoms, patients can have lots of different blood counts or functions within their bone marrow. And terms that are sometimes used are proliferative versus myelodeplete or cytopenic myelofibrosis. And kind of the key feature of that are the blood counts high or normal, or are the blood counts very low? And patients with either can have different disease courses and have different approaches to treatment.
The difference between myeloproliferative and myelodepletive disease is in the blood counts. In medical terms, myelo stands for bone marrow, and proliferative means fast growing. So someone with myeloproliferative disease has bone marrow that makes too many blood cells. This appears in laboratory tests as high levels of red blood cells, white blood cells, and/or platelets. In contrast, the bone marrow in myelodepletive disease doesn't make enough blood cells. This appears in laboratory tests as low blood counts for red blood cells, white blood cells, and/or platelets. Myelodepletive disease is commonly called cytopenic disease. There is another way that doctors characterize myelofibrosis, either as primary or secondary. Primary myelofibrosis is a blood cancer that develops on its own, whereas secondary myelofibrosis is a disease that evolves from another blood cancer a patient already has, like polycythemia vera or essential thrombocythemia. Which one has a better prognosis or outcome?
Primary versus secondary myelofibrosis is a little bit of a tricky question. Which one is worse? I think that is still an area of work that we're doing to understand within those groups which patients have a better prognosis or worse prognosis. In general, patients with primary myelofibrosis tend to have a worse prognosis than patients with secondary or post-ET or post-PV myelofibrosis. But clearly, if you take those two groups, there are layers within those groups.
Some questions that pop up for doctors when considering prognosis are, what will symptoms and blood work look like over the natural course of this disease? How might quality of life change over time? What is the expected outcome of a treatment? And how will it pause or modify the progress of the disease? The way doctors try to predict how a disease will look over time is by using something called a prognostic model.
And so we use these things called prognostic models to understand, even within those two groups, which patient's disease is predicted to do better over time or worse over time. So we use these prognostic models as our staging system to understand whose disease might be more aggressive at the time versus somebody else's. That way, we can apply the right treatment. The more aggressive the disease is, the more aggressive we need to be with it.
As you and your doctor consider treatment options, or if you're already on treatment, be sure to keep asking the questions you need answered. And if you're looking for more, you may also be able to speak with a specialist like Dr. Gerds. These doctors are called MPN experts, and they can be found throughout the U.S. They can work with your doctor or on their own. This way, they can provide expert advice for the next steps of your treatment.
So after a diagnosis of myelofibrosis, one of the common questions is, what can I expect? And every individual's journey is different. So what I tell you and what happens to you may be different from the next person or the person after that. I think that's a key piece, is not everyone's experience is the same. And so we want to think about your disease course as something that's going to happen over time. And really the strategy for anyone is to address things as they come up. And we really think about three domains. One is the spleen, one is the blood counts, and the one is the symptoms. And that's really simply all it is. We monitor these things, and as events or changes come up, we address them directly. We're all individuals, and one person's myelofibrosis is not another person's myelofibrosis. So it's really important to say, okay, what are the things going on with their disease that we can really focus on to try to make better for you? Because if we really focus on you as the patient and what's going on with you, we can do the best by you in your treatment.
Knowing more about your myelofibrosis and better understanding what you're going through can be so important when venturing onto the internet to learn more about your disease. And if you're looking for more information, please browse our website for additional videos on myelofibrosis.